Good morning. It's Living. Every morning we come to you, 92.9 VOB FM, 9 to 9:30 every Saturday. We're talking about living and life and all the stressors and all of the good times and all the bad times. But life in itself is a journey, so you look at a baby just born, and then you think about what happened. The cells are dying every day. So the question is, are you born to die? Interesting concept, isn't it? You know, you look at little baby first cry, and then you know the dying process starts. And some people go longer than some. Well, anyway, it's a journey, and while you're here, we need to enjoy the ride. Today I want to talk to you about, thank you last week. I had some people sitting in for me and was away for a few days. It's good to be back with my people here, and I want to talk about breast cancer today because it's the number one cancer in the female population, and you have to know about it. And this cancer can happen to anyone. You know, it's not bound by age or gender or ethnic group. But it's the most common cancer found in females, so you need to know about it. And I still remember the 18-year-old who, she came to me a few years ago, and she said to me that she used to run 5 miles 4 times a week, and suddenly she started walking a block and she shot her breath. I checked her out. She had cancer of the breast, going all the way to the lung, fluid in the lung, cancer cells in the lung. She lived about God bless her soul, 2 to 3 months thereafter. And she was 18 years old. So, as I said before, this thing can happen to everyone. So, I spoke a couple of weeks ago, and I said to you that if you should follow your family tree, actually, and see what the family members, what the probabilities are. If your family, most of them are dying of stroke, odds are you will. Most of them dying of heart attacks, obviously you will. Most of them are dying of some type of cancer, most obviously you will. But modification of lifestyle has a lot to do with the genes, because even though you're born with the genes, certain type of foods, especially some red meat and other types that I can talk to you later about, could stimulate these genes and make them more active, as opposed to the more healthier living, which would make them more dormant per se. So that is why people who decide to become very much health conscious outlive their partners within that family tree that would eat not so healthy. Today we want to really talk about the world is made up of men and women, but you know, women are the people that drive this world, and we want to say hi and happy to all of you. Happy Saturday to all of you, and those people in wonderful, nice ladies. Where is that? It's on Pinfold Street. Is it Pinfold Street? Yeah, I think it is Pinfold Street. You listen every day. Jenny and all of the rest, and that wonderful lawyer office there. Hi to you, and continue to listen to our program. And Mike, you're back in town. I'll hear you for a couple of days, 3 days or so, all the way from the big US of A. I hope you have a good day. And David, you eventually retired now. You're here with your family. Yes, and those are some of the guys that diehard listeners to this wonderful program. We all want to live longer. As I said to somebody, all we know right now is this. You came into this world and you know this living. Afterwards, you will have to deal with the afterlife. Yeah. So, the afterlife actually, it depends on how you feel about it. And we all have our beliefs, and I would not rub mine on to anyone, but I'm an extremely heavy believer in the scripture and the words of the Lord. So, but we talk about breast cancer and females, and if you males, we're going to talk about prostate cancer next week. But we will talk about our ladies, females, our African queen, Egyptian queen, or all the type of queens you want to think about, because we owe our lives to you, and without you, we wouldn't be here. Okay, think about the female breast, you should know about it. I always tell my patients, actually, that they should do a breast examination at least every month. Understand your body. Your body was given to you, and you should know it. Every part of your body, you should pay close attention to it, from your head to your toe. If you don't, who wouldn't? So sit in front of the mirror, look at your ears, your eyes, and your hair, and your lips, and your nose, and your breasts, and your every part, your feet and your toes. You look at your body and know what's normal for you. Because remember, my ear might be bigger than your ear, but it's normal for me. And your smaller ear, normal for you. So once you know what normal is, then you can know what abnormal is. So the female breast consists of fatty tissue, fibrous, and connective tissue. It's made up of glands and a lot of lobes, 15 to 20 of them, and some small lobes too, and some tiny ducts. So you have this breast is made up of all this fatty tissue and some little tubes going through it, where you would have it combined together to get the milk coming out to the nipples and so forth. So after pregnancy, milk is produced through these tiny glands and so forth. Well, and also you have other things going on there in the breast. You got the lymph nodes, and you have, which normally traps cancer cells, bacteria, and all type of harmful substances in foreign body. And the lymph nodes are present in the entire body. You find sometimes if you feel your groin or around your armpit and so forth, you feel some nudges like. That's a lot of time. Your lymph nodes consist of a lot of fighting white cells in your body, trap all of these harmful bacteria and so forth that escape into your system. But that's also present within the breast of itself. But breast cancer, there are many. There are major two types of breast cancer. There's one called, the most common one is called the invasive ductal carcinoma. This comprises at least about 80 to 85% of the cancers within the breast. And it can be very aggressive too, It depends on when the pathologist would look at the tissue, and if it looks close to normal, then it will not be as aggressive as if it's a really abnormal looking cell, and that's how they define the aggression of your cancer. That is why some females that would have cancer, you find them dying very, very, very quickly, and some would be survivors for a very long time. Also, it has to be, of course, how soon you detect the cancer. But so we talk about invasive ductal, 80 to 85% of them. Then there's the infiltrating one. Now, so the invasive ductal one originates right into the ducts, into these tubes we're talking about, and then can expand outwards into the tissue, and then afterwards we're going to talk more about that too. Then there's the infiltrating one where the lobules, the 15% or so of the breast cancer, 10 to 15% are really the lobular ones, the infiltrating lobular ones, and that occurs in the lobules as opposed to the ducts of the breast. Now, those things, the words may seem a little bit Latin and a little more harder to really control using your tongue and so forth. But I say to you, it's important to know. The first thing is you need to know that what the consistency of your breast is. In other words, every month, just after your periods, you should, when the periods, you should be able to raise your hands up, and when you go to your GP, raise your left hand up and just feel it. There are various ways you can do it. circularly, or you can do it in a quadrant section. I must tell you that a lot of cancers occur in the outer quadrant. So pay attention to where the lumps are, the sizes of the lumps, and so forth. Once you would have done that every month, and make sure even if you do it during menses, do it after menses to see, make sure. In other words, when you have all these hormones being produced during your menstrual periods, you'll find that it'll be hardened breast tissue and so forth. So you wait after that and then you do it. And then you should do that every month. And if you do it, and if you find there's a change, that's where early detection can be made. Now let's look at some of the things that you look for from a layman point of view. Some of the things that you're in there, and Dr. Sparman is speaking about breast cancer, and he's talking about these invasive ductal carcinoma, and he's talking about intralobular carcinoma and so forth. And I told you over and over what cancer really is. It's just the cells becoming abnormal and producing abnormal proteins that it's not supposed to produce. Instead of producing X, it's producing Y, and the body has no use for Y, and so it just starts crazily producing more Y, and then becomes hard, tumorous type of products that spread all over the place and compress tissues and organs and damage function. That's the whole process right there. A lump or thickening that persists through the menstrual cycle. In other words, in your menses, you'll have lumps there, as I said, because your levels of female hormones are very high. So, if while junior menses is there, and then afterwards it's still there, you should be concerned. It should go away. Then a mass or a lump, if you feel something that wasn't there before, small as a pea, it may just be small, very small, like a pea, but it wasn't there before, it needs concern. How about a change in the size and the shape and the contour of your breasts? Again, you see, you have to know what's normal. You find that your breasts starting to have a different shape. Yeah. No, not be talking about one breast, we're talking about both you now. You're looking at both of them. You have to know. If they see the shape is changing, cause for concern. That's why we're going to consult the GP, and I'll tell you about testing that they can do to find out what's going on. Then we have a blood stain or some type of clear fluid discharge from the nipple. I'm not talking about if you just had a baby or you're pregnant and so forth, but generally just you're none of these things. You're not pregnant, or you're not post having a baby or so forth, postprandial, or any one of those words you want to use, and you find that there's staining of your clothing or blood. That's concerning. We keep going on. I hope you nice young ladies out there, and this is not only for the 40-year-old and the 50-year-old. This is for the young, the teenagers too. This program is for all of you, because cancer can happen. I said before in my opening statement that cancer can affect anyone. So what about a change in the feel or appearance of the skin on the nipple, whether it's dimpled, puckered, scaly, or inflamed? You see the nipple change up its color, or it looks a little bit like a dimple in there, it looks a little bit flaky or inflamed. Reason for concern. You need to see your doctor there. Redness of the skin on the breast or the nipple. Redness. Some people can get rash here and there. But you know there's a redness in one of those breasts there, and on a stitching or so, you need to find out why. But what about the nipple of itself? The shape? That nipple, if the nipple is somewhere else where it's supposed to be. I remember I used to work out when I was younger, and I still remember this. I had a nephew by the name of Ptolemy, and I started working out and pushing up, and then I find that the chest started to get bigger, and then the nipple moved downwards. If you look at most of the bodybuilders, what happens, the nipple are not straight out, they look downwards, because the muscular tissue push outwards, and that causes a movement of the nipple. And he says, hey, Uncle Steve, he's called me Steve, your nipple has moved out. I still remember that years ago. But if you find that there's a change in where your nipples were, a change in the position or the shape of that nipple, you have to know it, then that's need to concern. So, and if you look at the breast and there's any area that is different, from what it was before, you know that something's going on. Marble-like hardened area under the skin of the breast, all of those things. And how would you know that? You would definitely have to, of course, be checking every month. And no, a lot of ladies don't do that, but you have to. I don't know what you think about Angelina Jolie, and she's got, they have all these high-tech tests out there for people who are predisposed, who would have the genetic predisposition for certain type of cancer. And she took her breast out. She says, all right, I don't have to worry about that stuff anymore. It's less ladylike, some people feel, but, there are things you can do to make you more ladylike and so forth. But some people are controversial about that. But I remember once I told a lady to do that, and she was disturbed because they have is deeper than I'll come in, but enough, you don't want it much at you. So we talked about symptoms, what you should look for, the breast exam and so forth. When we come back, we'll talk about how do you go about diagnosing this stuff and what should you do to prevent yourself from dying early from breast cancer. Yeah, that was Two-Face, Divya, African Queen. Yeah, you queens out there. We're talking about breast cancer and how much it affects our female population. And as a matter of fact, there are risk factors for that. It includes race, geographic location, socioeconomic status, family history, genetics, exposure to radiation. Now listen to this one. Obesity. So you're obese, you have a high risk for breast cancer. Alcohol intake, drink a lot of alcohol. Yes, you're at increased risk for breast cancer. And diet. Yes, if you eat a lot of red meat and fatty foods and fast foods and trans fat, those are the things I was talking about earlier, and I said that they can stimulate those bad genes to be more active. What do you do if you find that you have these lumps or bumps or change in your breast contour or whether it's a discharge and all these things? Your exam is different as you do it monthly, and monthly for the rest of your life, okay? Studies have shown that if you're under age 45, one in every 8 women would have breast cancer, but over 45, well, as a matter of fact, over 55, it's 2 in every 3 people who are diagnosed with breast cancer. 2 of them in every 3 are over 55 years, as opposed to those diagnosed under age 45. So it happens at every age, but as you get older, your chances of breast cancer increases. The doctor normally would do a biopsy. First they do a mammogram, and then thereafter maybe an ultrasound-assisted biopsy to see what the tissue is like. If the tissue shows there's some type of cells which are cancerous, meaning it's different to the normal cells, they'll try to see if it's spread anywhere to the axillary area or in the armpit, if you want to call it, or if it's gone to the lung or anywhere else. The further it is gone, the worse the prognosis, so you want to have it contained early. So I don't believe, and I say it openly, and I say it nationally, and I say it again, I don't believe in lumpectomy. I don't. I'm sorry. because you get the tissue, you pick up tissue from a fine needle biopsy or so forth, and you decide to take a margin around that area, and that's the end of it, and 2 years down the road, the cancer is in the breast. I feel that cancer does not belong in anybody's body. And I say this again. If you have cancer anywhere in your body, in that organ, take it out and deal with it. Live along and survive, and tell people about survival. But just because of cosmetic, you can find yourself in trouble, because once it's spread to other tissues, you got serious problems. So once a diagnosis is made, now they could find out if it's responsive to estrogen therapy or progesterone therapy. In other words, a lot of these cancers, female hormones, estrogen or progesterone, can cause them to grow more aggressively. So doctors would give you some type of anti-hormonal therapy, like tamoxifen and all those things, to block and to decrease the progression of the disease. There's so many things that can be done. You got surgery, you got chemotherapy. Sometimes the doctor may include radiation, hormonal therapy, biological type of therapy, and so forth, whether you have a receptor positive or not. And then based on the size of the tumor and the location and all those things, they can stage it and decide what type of therapy is best for you. But the therapy for breast cancer is one, or to prevent yourself, or to decrease, let's use this is better. To decrease your probability, because life is all about probabilities. To decrease your probability of having breast cancer at an early age, or to prolong the process, you should have monthly breast exams just after your periods, and keep check, knowing what's normal. And once you find it abnormal, then you should have a mammogram, and then the doctor thereafter can refer you to the appropriate person who can decide what to do. Let's fight against breast cancer. Next week when we come back, we will talk about prostate cancer, the most common cancer in men. And men, I want you to tune in for that. But females, don't forget now, every month, do your examination. And don't forget also that breast cancer, sometimes there's an association with some genes that you may have that are associated with other gynecological cancer, like ovarian cancer and cancer of the uterus and so forth. Here's your good doctor talking to you and saying, hi, may you have a good day. Be careful on the roads today, African Queens, and just got a weekend there. Take the kids out to the beach and, enjoy what the Lord has given you. Thank you for listening. In the kitchen, in the radio, in the car. Yeah, see you next week. Here we go. And these are my type of songs. Tara Siley and African Queen. She's royal. And I'll see you next week.